Hello there. So today I'm going to talk about why the cost of dental cleanings has increased in past years. So dental cleanings are a lot like spays and neuters in the fact that just because the procedure has the same name between clinics does not mean that the same things are being done. So you can still find very cheap dental cleanings at some low-cost spay neuter clinics and whatnot, but that doesn't mean that it's the same as getting it done as a general practice. So, number one, anesthesia has gotten more expensive. And the reason for that is, so I can remember whenever I was a technician, and it was a long time ago, probably like 20 plus years, the first time I saw a dental cleaning done on a dog, they gave injectable anesthesia off the needle, which means there was no IV catheter given. It was just drugs that would keep them asleep for about 30 minutes. They were intubated, a tube was placed in the trachea, but it wasn't hooked up to anything. They only had hand scalers, there was no power associated with it. They did not polish. The person that was doing the dental was also the person doing the anesthesia, and they only had an SpO2 probe on the animal, which only measures their oxygen saturation and their heart rate. Nowadays, your general anesthesia is going to be a much higher caliber. Typically, animals are going to get an IV catheter placed. They're going to get IV pre-medications that make anesthesia a little bit easier. They're going to be induced with something like propofol, kept on gas and oxygen while they're under through a tube in their trachea. They're going to get IV fluids during the surgery. They're going to get pain medications. You're going to have an ultrasonic scaler, polishing afterwards, dental x-rays. So just in general, your anesthesia has gotten more expensive. Also, more clinics have dental x-rays, and it's one, better medicine to have dental x-rays, but two, it's also a little bit of a response to some complaints from clients. I have seen patients before, when dental x-rays were not super popular, that a pet came in, had a dental cleaning, got everything cleaned up. A month or two later, ended up getting a tooth root abscess that ruptured out of the side of their face. In that dental cleaning, that tooth looked fine. The only way that it would have been found is with dental x-rays. That client ends up getting mad at the clinic for not seeing it when it wasn't physically possible for them to see it. So because of that, dental x-rays are becoming more popular. That adds price. That also adds the number of teeth that should be extracted, which adds price. Also, in your general practice setting, we are able to remove some teeth that we weren't previously able to remove. With that ultrasonic scaler, most of those dental units are going to have a drill. That drill allows us to remove teeth that have multiple roots that we may not have been able to remove before. We have all kinds of tools that help us elevate gums and do this and do that to get teeth out. But in a lot of instances, it was almost impossible to get some of those big teeth out without cutting the tooth into sections, which we can now do in most general practices. So it is annoying. It is an investment when you're doing a dental cleaning, but doing less than that really is more for us than it is for the dog. If you're just cleaning off the surface and not taking care of any infected teeth or not looking for infected teeth, that's not actually helping with the health of the pet, which is the goal of a dental cleaning. So next I'm going to talk about non-anesthetic dental cleanings and why I don't recommend them, and then just some general tidbits about dentals in general.